Welcome back to the Morning Blend. Well, reports say that today 1/3 of Americans are obese and many more are overweight. We're a nation desperate for a weight loss miracle. Is the HCG diet the answer? Today, a medical doctor and HCG diet expert weighs in, so to speak, on this very popular diet that was first introduced back in the 1970s and is now making a big comeback.
Dr. Susan Riegg has 22 years of experience in medicine and laboratory science, and she's an expert on hormone balancing, wellness services, and the HCG diet. And she's now offering the medically supervised diet at the Wisconsin Vein Center and MediSpa, where Dr. Deborah Manjoney is the medical director. Hi. Thanks so much for being here.
Thank you. Nice to have you.
So exciting. I think this is great because you're celebrating your 10th year of business.
We're celebrating our 10th year of business, and you know, we have expanded once 5 years ago. Now we're expanding again, and actually this is going to be a sister venture. And so Dr. Riegg has very graciously decided to help join us and get this going. And so we will be opening something called TransforMDiet and Wellness Center, adjacent to our own business. And Susan will be there a couple of days a week seeing patients, and then we'll also have support staff with a nurse practitioner to help people through the diet stages and beyond.
Dr. Manjoney, I want to ask you, because we've talked many times about what types of services you offer at the Wisconsin Vein Center MediSpa and what services you don't offer as well. Why did you make the decision? Because you're an expert. You used to be a cardiothoracic surgeon. Why did you make the decision to bring this as a service that you're going to offer?
Well, as you already spoke about, 1/3 of this country already is obese or overweight, and we are very concerned about where we are heading as far as that goes. And so some people get very discouraged about how they look, how they feel when they are obese. And I think it just works very well to bring in not just ability to diet, but actually the wellness part of it, so that people can stay well, and we know they're going to be much healthier if they get down to a healthy weight. And Dr. Riegg has the experience of dealing with a diet that will help people lose weight rapidly and really improve their health. I think you can even speak to, about a few people who you've seen blood pressures come down, they've come off medications that they've needed because their weight comes under control.
Yeah, I think from the perspective of what's the benefit of this particular diet, from a medical perspective, we really like to get patients some sort of quick wins on the board. In other words, we want to get some rapid weight loss, safe, effective, and sustainable weight loss. And this really inspires the patients. It gets them very excited, very involved in the process when they're starting to see some real benefits and some real success. And then we, take it to the next level as far as talking about, bioidentical hormone balancing. Obviously, we're incorporating strategies to break food addictions. And we're talking quite a bit about the problems with gluten and wheat and what impact that's having on people's weight and also on their hormone imbalances.
Well, when we talk about rapid weight loss, the HCG diet has been featured on Dr. Oz before. I've watched the whole special. When we're saying rapid, we're saying 6 to 10 weeks. People can lose 20, 35 pounds. I mean, and this is not unrealistic. This is consistent.
Well, what we see in females is about 1/2 pound a day over time. So over a 6-week period of time, which would be roughly, 42 days, the minimum we're going to see is 21 pounds of weight loss. And I will tell you, this process goes extremely smoothly. Patients are, for the most part, not hungry. As a matter of fact, a lot of patients will complain that they can't eat all the vegetable that's designed in the diet. So hunger is not an issue, and we work very hard to make sure the patients are very comfortable. We don't want anybody to be hungry or feel deprived. So hunger is not an issue. Dealing with the food cravings and the food addictions and people kind of missing what they used to eat, that's a different story, and we have strategies for dealing with that.
And I want you to explain too exactly what the HCG part of it is, because a lot of people have heard it's a human hormone, and that's what's helpful in helping people lose the weight so quickly.
Absolutely. Well, what we're using pharmaceutical HCG, which is exactly what was described in the original manuscript.
So you can't get it at a vitamin store.
No.
You can't get it at a center. You have to go to a pharmacy and a doctor.
Right. The HCG that's present at places like GM GNC and Walmart is homeopathic HCG, and interestingly, that has no hormone in it. So we are truly using pharmaceutical HCG from our compounding pharmacy. We can provide it either injectable, very tiny needle, it's an insulin syringe, or sublingual under the tongue. But we're using exactly the protocol that was described in Dr. Simeon's manuscript. And what the HCG does is preferentially help burn abnormal fat stores and help release that fat so it's metabolized and uses energy stores. What we prove is that throughout this process of weight loss, that the patients are exclusively losing weight in the fat component with preservation of lean body mass and preservation of muscle.
And that's the very important part of this, is that as opposed to the homeopathic HCG, this is all involving a very low calorie diet, and there may be some hunger suppression with whatever you're using, but with this one you're preserving your muscle mass to the best degree possible. And so it's really a very good, safe way to diet and get the results quickly. And as you know, Leroy Butler was just talking about, when you feel good about yourself, you're going to do better and everything's going to be better. And that's really what we feel, that as people start to lose weight, they'll be encouraged to, you know, go forward and be more confident and do things.
Absolutely.
Yeah.
I think it's wonderful. I've worked with Dr. Riegg for over a year, and I think it's great that you guys are teaming up. Here's how you can contact TransforMDiet and Wellness Center. It's 1-800-LOOK-GREAT to contact them, and you know where the Wisconsin Vein Center and MediSpa is located. They're on Georgetown Drive in Pewaukee. The phone number for more information is 262-746-9088, or visit WIMedispa.com to learn more about the HCG diet. Thanks so much for being here, ladies.
Thanks for having
Nice to have you.